Hey guys, this is Dr. Adkins here. I wanted to talk to you a little bit about pediatric, sleep-related or daytime-related breathing dysfunction and how your dentist, us, can help you. I wanted to show you some pictures. They speak 1,000 words because I want you to help me screen some of the children in our community, your own kids, your kids' friends. And I'm going to show you some pictures and then I'll tell you why these pictures are relevant. So, if you look at this picture, I want to know if you have a child at home that kind of looks like they're ADD, ADHD. Here's another friend of, who has ADD, ADHD child. I want to know if your children have developed longer faces. Look at these images, these two images, where the children have developed elongated facial structures. And if they chronically look like they're breathing through their mouths, I want to know about it. I want to know if your children have developed jaw structures that are of different sizes, meaning the two jaws don't seem to be working together and growing together, like this one where the lower jaw seems to be, reclined compared to the rest of the face. I want to know about that. I want to know if you watch your child and if your child looks like whenever they sleep, they seem to be breathing through their mouth. Maybe they snore, maybe they don't, but I want to know if they chronically look like they're breathing through their mouth. When you look at your child's mouth, I want to know if it looks like the teeth don't seem to fit, and if the arches seem to be narrow. I want to know if the palatal development seems to be very high, and I'll show you that picture is right here, where the narrow arch develops and the palate forms way high. It's a vaulted palate. I also want to know if your child's teeth look like this, where they are worn down, if they grind their teeth at night. Some of you have heard your children grind their teeth. It has a distinct sound. Some of you are not aware of them doing it, but you can look at their teeth and it looks like they've worn them flat across. I want to know that. I want to know if you look at your child's mouth and they chronically have swollen tonsils in the back of their throat. Some of these children are the ones that chronically get strep throat. So I want to know if your child's throat chronically looks red and swollen. The reason I say these things, all of these things are signs we look for children who have breathing dysfunction. These are signs that are relatively easy to spot from you with your help. And if you see them, please bring them to me and I can evaluate them for conditions that may be able to help, we may be able to help with. And I want to show you one picture that I picked up from Dr. John Mew's book. This is a picture of a 6-year-old little girl who was a severe mouth breather. And this is her 3 years later at 9 years of age. If you leave a child untreated for breathing dysfunction, they tend to develop these elongated structures and their lower jaws seem to get out of the growth pattern of the rest of their face. How wonderful would it have been for someone to be able to get a hold of this child at 6 years old and actually correct this issue versus having to deal with skeletal formation problems 3 years later. It's just a 3-year span of time. So if you hear your child breathe funny, if you watch them and they seem to chronically breathe through their mouth, if they're ADD, ADHD, they can't seem to sit still, if their facial development seems to be getting elongated, if your children are not sleeping well, they're sleepwalking, sleep talking, they're wetting their bed into early childhood, any of these things, please give us a call. Adkins Center for Dental Medicine, we want to see your children. I appreciate it. This is Dr. Adkins. I will talk to you soon. Thanks.